Howdy, folks. Thank you very much for joining me in this live podcast. I do appreciate your questions while I'm speaking. This is a very big subject, and there's a lot of misunderstandings that people have about cancer. This podcast is not going to cover how to treat cancer per se, because that's a very large subject. And of course, there's many different forms of cancer. You have growths, such as tumors, you have skin cancer, you have blood cancers, you have liver cancers, and you have different type throat cancer, lung cancer. So you have many different types of cancer. So they all need to be treated individually different. But what we're going to cover here is not these individual treatments, because that's a huge subject, but we're going to cover some of the common misunderstandings about cancer. First of all, other countries, specifically India, are treating cancer on a regular basis, and most wealthy people around the world, particularly Middle Easterners and Arabs in particular from the UAE and Saudi Arabia, when they have cancer, they do not come to the United States, they go to India. And you could go online and you could search for Ayurvedic Cancer Clinic, India, and you can find there's thousands of them. Now, of course, you have to pick the right one. It's good to know people, but there's many that are decades old and have a very, very good reputation. In fact, many of the cancer clinics in India that are, not using chemotherapy and radiation, or just using Ayurvedic treatments and herbs, are huge, as big as college campuses with multiple buildings, where every building is for a particular type of cancer, with large parking lots and thousands of people working there, just massive. And so they exist, and they've been treating cancer using Ayurvedic herbal treatments for decades. Many of these old hospitals in India were built in the 50s. And some of them were Ayurvedic hospitals. Of course, in India, you have Western hospitals, you have Indian hospitals, and you've got hospitals that even provide both forms of treatment, both Western pharmaceutical and Indian Ayurvedic. So there's not such a big division in India. But if you were to go in to one of these large cancer clinics or hospitals in India that's using Ayurveda means, it would be hard to say that cancer's not treatable, because they're doing it. They have the evidence there. And in fact, in the 80s, I did go to a large cancer hospital, and I spoke to patients who were in the lobby waiting. They're just patients staying there, and many of them told me about their success and how they were so impressed. We don't see a lot of Americans even today there. We see more British, Australians, European, and Middle Easterners, wealthy Middle Easterners. Now, I haven't been in any cancer clinics in India for many years. Maybe more Americans are becoming aware that such treatments exist, and there are all proven alternatives. Now, you have to understand, though, you have to check in, and you have to stay in the center. It's not like my approach with my patients, where we do Zoom appointments, and then we send them the herbs and change the diet, give them some home remedies, and then they come back in a month or two, do a follow-up. We see how they're doing. We send them more herbs. That's kind of our Western approach. So you can keep living your life and kind of slowly treat conditions. But in India, you stay there in the hospital. They provide the food. They provide the herbs. So they're not explaining to you how to take the herbs. Even if it's not cancer, that is the approach in India. There, you are more passive, and there's very little explanation. They give you, here's your morning tea, here's your herbs after your meal, here's your lunch, here's your breakfast, here's your dinner. Even they're maybe observing the amount of liquid you're urinating, measuring it. They're even sometimes ask you to defecate in a bucket, so they can observe it, and sometimes even do tests on it. So they are in full control of your diet, your eating habits, and even exercise. They may take you out for walks, take you out for swims, take you out for yoga. So that's why their success can be so effective, is because it's not like in my case where, I have to, explain everything to the client, and the client has to do a lot of this all by themselves while they're going to work, while they're doing other things. So they control everything. And, lights are out at 9 p.m. You don't stay up. There's no TV in your room, no internet. Maybe they have like a special room that you can go to for your internet, and that's it. So very, very controlled environment. So that would be the best way to address any advanced cancer, is go to India, check in minimum 30 days, and plan to stay longer. And the rates are anywhere from just maybe, used to be only about $100 a day, including food, treatment, doctor appointments, tests, everything. But, there's been some inflation. So now people are telling me the price is really starting at about $150 a day now. So yeah, 150, 200 a day, really depending on the quality of the hospital. Some are more like resorts with swimming pools and lounge chairs and more recreational things. Well, some of them are more like a hospital where you just have a little room and there's really no other activities available to you. So that's really what varies. Once you go into the resort type, which is more comfortable, and you get a nicer room, maybe even a TV, and you've got a gym, an outdoor area, and some lounge, a pool, then that's going to knock the price up. That's what really increases the price. And a lot of people do prefer that, particularly if you're going to be there for a few months. So that's the first eye opener that I really wanted to communicate to people, is that cancer is very treatable. But the best are in India, better than any other place. For sure, undoubtedly. So that's the first thing you should know. Second thing is that, no one treatment is going to solve your cancer problem. And I know a lot of people who end up with cancer, they're looking for, that little magic pill. And people try many things, not to say that they don't have benefit, but this concept of looking for some, one cure. You can see colloidal silver. People do Isiac tea. People do apricot kernels. And, they're betting on that particular single treatment. Now, again, there's many types of cancer, so that's already a little flawed right there, because you really need to treat each type very individualistically. A growth cancer is very different than a blood cancer, and the herbs, the treatment, the approach is completely different. So the whole concept of taking one herb, one tea, one food that's apparently, stops cancer, well, that's flawed. Not to say that they don't have some value and some anti-cancer properties, but that concept of betting on apricot kernels, for example, if you know what I'm talking about, or Isiac tea, that's very dangerous. That's incomplete. So what do you need to do when you treat cancers? You have to think very holistic. First of all, you got to treat everything you can. That's the first policy, because, destroying cancer cells, stopping, shrinking a tumor is all going to take time. So in the meantime, or at least initially, you got to treat every health condition you can to make the body stronger, because it's really we're going to explain why you get cancer according to the Ayurvedic perspective in a minute, but it has a lot to do with your immunity. So anything affecting your immunity, anything adversely affecting your immunity, medicine, antibiotics, anything that's blocking in your body, lymphatic blockage, colon blockage, gallbladder blockage, all can make it worse. Anything blocking the eliminating organs, because cancer also has a lot to do with toxins. So you need to be making sure you're getting rid of toxins. And one of the few causes we're going to cover it is toxic accumulation in that part of your body. So, that means you can't be constipated if you have cancer. You can't be like urinating all night and and not urinating in the day. That's a sign of blockage in the kidney bladder pathway. It could be kidney stones. It could be other things, but you're not eliminating the toxins through the urine, bladder urinary system quickly. Maybe there's an issue with the kidneys, but that needs to be flushed out, and the urine needs to be flowing good in the daytime, nice flow, and not into this at night, which is a sign of blockage. And you got to be sweating. You can't have dry skin, because we do eliminate a lot of toxins through the skin. And of course, there can't be breathing problems either, because we need oxygen. And oxygen, just like ozone therapy, is very effective at fighting cancer cells. So if you're on a CPAP machine, you're having asthma, you're having any breathing problem at all, you better fix it immediately. And we're not talking take an inhaler, because an inhaler or any drugs is just more toxin. So you have to resolve the constipation, resolve the nighttime urination, resolve the breathing problems. And of course, you have to resolve the digestive problems, because if there's any deficiency, nutritional deficiency in any manner, which often can come from poor digestive problems, then, how's the body going to have the strength to recover? So you got to improve the digestion, improve the elimination in all aspects. And so you really should focus very holistically on the body. And if you're taking any medication, whatever that condition the medication's for, needs to also be addressed. If you're taking, blood pressure medication, or definitely if you're having high blood sugar, which, sugars create more, fungal infections and more of an environment for pathogens to grow, not just urinary tract infections. So you really have to get the blood sugar under control, and just taking a medicine is kind of an artificial way to control it, and it's more toxins. So you really have to treat the blood sugar or blood pressure or other issues the person has. And a lot of times we have to treat the liver. If you have high cholesterol and you're not eating, hamburgers and lamb chops every day, and you still have high cholesterol numbers, then we know it's the liver. Liver's poorly functioning. So a lot of cancer people just need to take the liver herbs, particularly if you have a long history of taking pharmaceutical drugs or recreational drugs, any type of toxins, or just you've been in the military, or you've lived near, a highway, and you've been inundated with toxins and smoke and pollution and shots and vaccines. They're all toxic for the body. And this is only going to burden your liver and contribute to possibly even cancer in the future, and definitely confusing your immune system, fighting all these toxins. And then, this can create autoimmune conditions, immune deficiency syndrome. So you really have to clean up every aspect of a person's health. That's really very, very important. And I just don't see people doing that. They have cancer and they're so worried about the cancer, they're just looking for some quick cure, and they're not sleeping well. How are you ever going to recover from a cancer if you're insomniac? You need that sleep to re-strength. You need the strength for your immunity. So if you're not sleeping well, it's going to be very hard to recover. Cancer, in a way, it's a battle between the toxins and the pathogen, and which can become cancerous and spread, and your own body to fight it off and defend it. Because if you read about autopsies, most people over 70, definitely over 80 or 90 who pass away, they all have little lumps, little detections of cancer. They say almost all men have some type of inflamed prostate to some degree. And all through history, people were kind of a little bit precancerous when they died, but they never had any symptoms. Now, if they would have lived to 150, maybe that cancer would have caught up with them, which shows, as we're aging, we're more and more susceptible to cancer, and most of us just die or pass away before the cancer manifests itself, unless, of course, you get a biopsy, which can spread it very quickly. But that's a separate subject. We're not going to talk negatively about medical treatment. We're going to talk about the options you have available, which I did with India. And we're going to talk about a better understanding of why you even get cancer. And that's hopefully the best approach, is to be preventive. Now, using microwaves is cancerous, burned food, grilled food, cancerous. Nonstick pans may be one of the largest cause of cancer, and many third world countries are still using nonstick pans. So you really want to avoid anything that's carcinogenic. And burned charcoal food is carcinogenic. Anytime you burn your toast and there's some black on it, that's carcinogenic. Anytime you turn on your microwave, you're making your food carcinogenic. So if you've been microwaving your water for 20, 30 years, of course, smoking can lead to cancer. Now, even colon cancer, for example, it takes decades and decades for the cancer to manifest and start having you symptoms. So many people could be pre-cancerous or in the early signs without being officially having cancer and not know it. For example, people who had colon cancer all had decades of constipation. So it's always a pathology. Doesn't just show up. Usually for colon, for example, you got constipation, then you got diverticuli, maybe you had hemorrhoids, maybe you had fistula, then you've had diverticulitis. So, you've had problems in the colon for a long time and you never really resolved them because you didn't know that you were supposed to have a couple bowel movements a day, not skipping days. And that just, of course, has many adverse effects on your colon. Your colon is like the drain pipe of your going straight to the sewage, out the back. So if that's not the sewage, you're not flushing your toilet every day, that's going to create pathogens and germs and bacteria is going to start accumulating in the colon. And over decades and decades, this is creating a cancerous environment. Doesn't mean you're going to get it because you're constipated, but you're on the pathology. You need to take these conditions, symptoms seriously. Same with acid reflux and GERD. I mean, it can be a little annoying. You could take Tums. But, if you get years and years of acidity, first you can get like some sore throat. You can even start to have trouble swallowing from the scar tissue that developed from years of acidity. And that can even progress into throat cancer. Now, of course, smoking, we all know, is a carcinogenic, throat cancer, lung cancer. But you could be not smoking and just live near a highway and get lung cancer. You could be not smoking and, maybe be in the military where they do burn pits, where they're burning rubber and plastic and things out there and inhaling it and get lung cancer. So, you're really trying to live in a most cleanest, pristine situation you can. All these chemicals we have in our foods, if you're eating non-organic food, your probability of getting cancer is much higher because many of these dyes and preservatives are carcinogenic. It's well known. I mean, you can just go Google them and learn about them, but many dyes, like I think it's red dye number 4 is considered pretty carcinogenic. Some of them are different. So if you're eating candy, you got dyes in it, you got preservatives in it, you got and you've got sugar in it. And, sugar not only can create diabetes, but it can, as they say, feed cancer. So if you're eating candy and cookies with preservatives and chemicals and sugar, obviously your probability of some type of growth cancer is going to be much higher than a person growing his own food, living organic, not smoking, living away from the pollution, living in the countryside. And of course, that's one reason I live in the countryside and grow my own food, is because I want to be consuming fresh air, fresh water, and, healthy, pure food. And that's just not possible in any city. So I live in the countryside. So all this is preventive, of course. So hopefully can live to over 100 and not have cancer. So all of these things that you do throughout your life, like, eating organic, not having junk food, all of these things are going to help you to prevent your cancer accumulating later in life. So now let me talk about from the Ayurvedic perspective on what causes cancer. Well, of course, in Ayurveda, it's a doshic system. We have 3 doshas, Vata, Pitta, and Kapha. And in cancer, most conditions are an imbalance of 1 dosha or 2 dosha. If you're overweight, fatty liver, high cholesterol, those are all kapha imbalances. If you have acid reflux, heartburn, burning skin, red skin, anger issues, those are all pitta imbalances. if you're depleted, underweight, constipated, gas and bloating, and insomnia and having anxiety, those are all vata imbalances. Now, of course, people can have combinations. You can have vata imbalance, pitta imbalance with kapha imbalance, etc. But and to have cancer, a malignant cancer, that's you have to have all three doshas in balance. So you really, and nobody's born with all three doshas in balance. So you definitely are the creator of this condition. Because unless your mother was living out of, I asked a cancer doctor, an Ayurvedic cancer doctor one time who visited me, and I was driving her around, and I asked her the question, why do children get cancer? And they said, the mother's diet, the mother's food. And she was from India, and she says it's a big problem because the women are cooking in these nonstick pans, and then they have children, and the children end up having brain tumors. And she believes it's from the nonstick pans. But also in India, they do a lot of fire pits, a lot of burning. So, they've got, even you're living out in the countryside, people are exposed sometimes to more chemicals than, we who can buy organic food and things like that. I digress and go back to the what the Ayurveda sees as the ingredients or the essentials for you to have a malignant or life-threatening cancer. You have to have imbalance of vata, pitta, and kapha. So what's kapha imbalance? Kapha imbalance is usually the tumor. That's, the lump. If you have high fibroids, cysts or tumors or just lumps, even little lumps on your hand or just lumps on your arm. Well, these are all not good. They're lumps. And generally that comes from a high protein diet. Too much meat, too much protein powders, too much things like that. You see weightlifters, they're trying to build muscle, but they also can build tumors and growths. Women get uterine fibroids and cysts, all from this excess protein, excess kapha, and just overweight people. They're overweight and they can have big lumps and not even know they have these lumps and tumors. So that's part of particularly for a growth tumor. Kapha is generally the first imbalance. You're growing some lump. Doesn't mean it's cancerous. You just have a lump. That's why they always like to test these things. But you need another quality is we need the vata to be high. And the vata its qualities are dry and light. So that usually means a blockage somewhere. There's a blockage. And sometimes the vata can be first and creating the blockage. How do you know if you have a blockage? If you're constipated, you're blocking. If your hands and feet are always cold, you have circulatory problems. It's a type of blockage. If you've had gallbladder problems, that's a blockage. Your gallbladder's not coming out. Even if you feel dizzy and lightheaded and have to lie down, you have some type of blockage. So it's easy to have blockages in the body. And when a blockage is stopping the body from getting the nutrients to the tissue and removing the toxins from the tissue, which is, how we're going to accumulate toxins in that particular area, because there's got to be some type of blockage taking place. And then there's an accumulation of tissue or lump forming, partially due to the blockage. It can go either way. The lump could come first and start blocking circulation, or the circulation could come first and start creating the growth. And sometimes the growth, just like a clot is a type of growth. So, it doesn't have to be something big. It just have to be a dense, growth or a clot taking place. So you've got this blockage, and also there's a certain depletion that takes place, which is vata, and that's coming because of the blockage, the poor circulation. So there's a lack of nutrients getting to that tissue that we're talking about. That's the vata. And then there's a inability to get the toxins out. That's also part of the blockage. And then the third aspect, so you could have a big lump, like a breast tumor, or for example, and still not be cancerous, of course. That's why they want to test it, because you need the third element, the third imbalance, and that is the pitta imbalance. And once that lump becomes malignant, then it becomes, that's the pitta. So if, say, you have a lump on your shoulder or you have a big sore on your skin, that's but it's not hot, it's not red, it's not burning, then and there's no heat coming from it, it's not inflamed, then that generally means there's not pitta, which basically translates not cancerous. So if you have like a dark spot, but it's just dark and it's not red, it's not inflamed, it doesn't feel hot, generally and it doesn't keep growing, that means it's not cancer. If it keeps growing, that's the cancer growing. And if it's hot and red and anything red and hot, that's the pitta. Now you have all three imbalanced. You've got the inflammation and the burning, plus the lump, plus the blockage. So that's the three ingredients you need to have cancer. Let me just, there, my dog kind of settled down. He's trying to get in. But so to treat cancer from an Ayurvedic perspective, you have to balance vata, pitta, and kapha, all three. So, and one could be more of the cause than the other. Now, if the person is vata, generally the vata will be the underlying cause. And if the person's dominant dosha or prakriti is pitta, it's probably pitta is the dominant dosha you should try to balance first. And if the person's heavy and overweight, probably that kapha dosha is the dominant dosha that you need to treat. But you have to treat all three. And this is tricky for the Ayurveda practitioner because just like somebody new to Ayurveda knows, if you have a patient and they have all vata imbalances, it's very easy. You give them vata diet, you give them vata balancing herbs, and this vata comes down and all their symptoms of gas, bloating, constipation, insomnia, depletion all go away. But it gets more tricky real fast when you have, say, vata and pitta. Now you have inflammation, burning, acidity, anger, plus you have these constipation, and anxiety going together. Now you have two doshas to imbalance. So even for the, the new Ayurveda practitioner, it's getting a lot trickier real fast, just having two doshic imbalances. In fact, many new Ayurveda practitioners just aren't really that good at treating two doshic imbalances, and they just see the major one and treat that one, when in reality, they really needed to treat both. But when you have cancer, or a patient has cancer, you really need to treat all three. So it does and there's people who have all three doshas imbalanced, but don't have cancer. So just because you have vata, pitta, and kapha imbalance doesn't mean you have cancer, but it definitely makes you more susceptible. And I do warn the clients at that point that these doshas need to be balanced quickly, at least one of them, to take away the fundamental ingredients necessary to become to avoid having malignant cancer. So that just shows you the importance of treatment, and it shows you how complex it is even for an Ayurveda doctor. Even for me, if I have a client who's got all three doshas imbalanced, even though she doesn't have cancer, and that definitely makes her susceptible to having cancer and is taken very seriously, it becomes very tricky and very time consuming, because after one appointment, I can get this pitta imbalanced, but I haven't got the kapha imbalanced because she's got 60 pounds overweight. So I've really got to lose that 50, 60 pounds before I can even get that kapha imbalance taken care of. So it can take time, particularly kapha is slower. And you really have to know what you're doing, because you may give a diet to balance the kapha. You may give herbs to balance the vata and the pitta. So, you have to know what you're doing. And maybe 3 months down the road, they've lost the weight, so you don't have to worry about the kapha. Maybe you're giving herbs to treat the vata more later on, and even you may change the diet. Now, as far as the diet, of course, it all depends on the doshic imbalance and the type of cancer. So there's no one diet for cancer. I mean, there's certain things you want to avoid, inorganic foods, in most cases, a lot of animal protein, but that doesn't include ghee. And if you have a depleted person, you may even be fine with depleted, underweight type of person. You may even have animal protein, may be okay. But mostly we're leaving out most of the animal protein, with the exception of ghee. And it tends to be a restrictive diet because you're trying to balance all three doshas. And there's no one diet, again, for cancer because you have different types. You've got blood cancer, you've got skin cancers, you got growth cancers. Now, when it comes to skin cancers, there's a lot of Ayurvedic oils that are used topically for that. So you not only may have a change of diet, you're taking internal herbs, you're taking herbs to sleep, you're taking herbs to go to the bathroom, but you probably, if you have a skin cancer, you're also taking external herbs on the skin. And if there's a lump that's in reach, like a breast lump, then we can also put different types of castor oil packs and things on it to help to break that tissue down. So you can have external treatments, internal treatments, and dietary guidelines. And these really need to go on for months. That's why it's just so much easier just to go to a clinic in India and just check in and let them take care of it. Probably even your lowest quality, somewhat tourist clinic in India is probably going to do better than anybody would be able to do on their own. And there's some that are very good. It depends a lot on the history of the clinic. It depends a lot on the skill of the doctor involved, many factors. In northern India, they're going to have a different approach than southern India. Southern India, they're going to do more abhyanga, sveda, and physical treatments with oil and sweating. And in the north, they're going to use more herbal, and they're going to use basmas, which are a type of mineral, which is very powerful, and they use them in the north, and they use them for many serious health conditions, but particularly for cancer. Indian doctor in the north is going to use these basmas, or these minerals, as well. It depends a lot on the skill of the doctor, not so much the hospital, but the skill of the doctor involved. So if you have a hospital and the founding doctor is still there, that's good. If he's already, like some of these hospitals are very old and the doctor's already passed away, but the clinic and the hospital are still going because, he founded it. Now it's still, they always put them in trust, and they're not, a lot of them are nonprofit, not like here in the States where they're all for profit. A lot of hospitals and clinics in India are in trust, so they can pass on to the generation, and they're taking salaries and things, but they're not a nonprofit organization. Most of old Ayurveda hospitals, clinics, even Ayurvedic herbal places are all in trust, so that it can live on and not have to, and not be a for-profit organization. So if the original founder is still there, that's always a good sign. But at the same time, if you go to some Ayurvedic clinic and, it's been around 100 years and it's famous and started by the original founder, but he's gone, it still could be very good because he was such an exceptional doctor. He has now students or his offspring who are continuing. So this type of, evaluation of these hospitals is important. And I, of course, know some in southern India and Kerala, and I know some in northern India up in Himachal Pradesh area. But there's probably many I'm not aware of. I did meet a very good specialized Ayurvedic oncologist. That was her specialty, and she was from Gujarat. And she's the one that told me that babies are getting cancer from what the mother took during pregnancy and nursing. So if you're nursing or you're pregnant, you really need to avoid microwaves, burned food, non-organic food, and particularly non-stick pans, which, according to her, is one of the biggest causes of cancer for newborn children. Well, I hope that opened up your mind to greater possibilities and help you realize that cancer is treatable. And many Ayurvedic doctors like myself are quietly treating this condition without any promotion because it's not acceptable. It's censored in our society today. But if you go to India, I would recommend going to India and visiting a few different places and making your choice and interviewing patients and investigating. And you will find plenty of people who have been cured by going to these Ayurvedic clinics in India. And that would open up your mind and help you realize that it is treatable. But of course, the longer you wait for treatment, the worse. And of course, if a person does chemo, I know some clinics in India that won't accept you once you've done the chemo, because I guess they considered you're too damaged and they have to treat the chemo, the damage from the chemo and your immune system, and it just makes the whole case more complicated. But I have visited many, and many of them will not take patients once they've done chemotherapy. They want to get them in the earlier stages before they're taking chemo and radiation. So I'm just relaying that to you, that is one factor. And unfortunately, most people, they just wait until the end, tried everything, and then they, go do the Hail Mary approach by going to India. And unfortunately, this is going to lower your prognosis of success because you've delayed for years and years. The thing to do would be to go in the early stages, in the very beginning, or even find a good Ayurveda doctor and treat it early as possible. That's where the greatest success rate is, in early treatment. Now, of course, Ayurveda sees cancer as a pathology. And there's 6 stages to the growth of all manifested diseases in Ayurveda, including cancer. And the West can only acknowledge or see through their testing when it's at stage 4. So Ayurveda doctor, he can see it coming, in the earlier stages, particularly when you see these 3 doshas are already imbalanced. They're probably already in stage 3, only just close to being able to have this detected by the medical world. So also, appointment with an Ayurvedic doctor can also help you to see the possibility and the probability of you having cancer down the road, and take action even before you are diagnosed with cancer. That's really the best approach. I mean, the best approach is first preventive, which I spoke about, and 2, regular, deeper checkup, so-called, with Ayurveda doctor, to get rid of all these things that can contribute to your 3 doshic imbalances, like constipation, poor digestion, poor sleep. All those should be resolved just to be preventive. And then still going to an advanced Ayurvedic doctor where he could see whether you have a probability of cancer in the future and start treating it and avoiding it early. You're not even the best time to treat cancer is when you see it coming before it's there. You can just, from experience and understanding Ayurveda and the fact that these 3 doshas have to be imbalanced, or in excess, we should say, then if an Ayurveda doctor sees these 3 doshas imbalanced, and a lot of other health issues as well, and maybe even medication that's further complicating the case, maybe without telling the patient, they are concerned that in 10 years this person could have cancer. And all of the actions that they do now to balance the doshas and improve all these health issues like, high blood pressure, cholesterol, diabetes, constipation, insomnia, by fixing all those, probably averted the cancer future down the road. And that's really the best approach, preventive. And then if every day be preventive of health problems as much as you can. And that's a big subject. And then 2, resolve all these small health issues and don't let them, progress before some of them could manifest, 10, 20, 30 years down the road into cancer. So I hope that opened your mind. I hope that gives you, if you do have cancer, I hope that gives you more hope and a sense that everything is treatable. And a lot has to do with the patient more than the doctor. So if you find the right clinic and you find the right doctor, then all the rest is probably going to rely on you. And not every patient is good. Not every patient can follow the diet. Not every patient can take the herbs. Not every patient's prepared to change their life. Many people aren't prepared to take 2 months off work and save their own life. So I would say, if people ask me if cancer is treatable, I'd say 100%. The real question is the patient. Are they prepared to do what it takes? That's really the big question at a certain level of skill and experience that an Ayurvedic doctor would have. His real question will be the patient. Where's their state of mind? Are they positive? Negative thinking is very detrimental. So, you have to have positive thinking. You have to have a good attitude. You have to have some discipline, and you have to be willing to treat all these little health conditions, not just think that you're going to find one product that's going to save you. Now, our sponsor is Herbman Teas, and Herbman Tea does have one product we call it Special Detox Blend to boost immunity. But if you know herbs, and if you heard of Isaac, the story, and I call mine Isaac Plus, and you can go to my website to read why I made it Plus. There's a famous anti-cancer formula of 4 herbs made by a nurse in Canada called Isaac Tea, and it was just 4 herbs. Apparently, she got this from Native American Indians. Nobody knew who told her. And then she met with a Western doctor, and over like 8 years, they added 4 more herbs. So then the formula become 8 herbs. Well, I've examined those herbs. I was not very impressed. The whole story was a little flaky to me. So I made my own formula, and I just call it Isaac Plus because I do use some of the herbs in that formula, particularly the sheep sorrel. Sheep sorrel is really known to be super anti-carcinogenic. So is red clover. So those are the first 2 ingredients. And dandelion root, of course, is for your liver. And same with burdock root, and same with yellow dock. These are all cleaning your blood, cleaning your liver. So I got 3 liver blood cleansing herbs in there: dandelion root, burdock root, yellow dock. Tulsi is for your immunity because immunity is very important. And then we have a few more anti-carcinogenic herbs in there, like wormwood, which is also used for parasite, cat's claw, which is from, and Paul de Arco, both from South America, with incredible antiviral, antifungal, anti-carcinogenic properties. And then we do put a little Carcinogenic sagrada to just clean out the bowels. And we throw in turmeric because people like it. It was not really necessary, but we put it in there. It does have some qualities, but not. So this is a very potent formula. And people have taken it, including the client I had earlier today, who husband took it, said that it brought down all of his inflammation, got his bowels moving, his skin got better. And I asked if he had cancer, and he didn't even have cancer. So I don't know why he ended up taking it. I think he bought it off of the website, herbmanteas.com. It's a big seller. I'm surprised how many people buy it and never contact me. And I think that's because they think, one bag of tea is going to, solve their cancer. Now, I only use that tea to stop the spread or the prevention of cancers because it's really cancer cell killing herbs in there. So we can just call the cancer really a pathogen at this point. So that's why you have these anti-parasitical, anti-cancer herbs in there. And then I put some colon herbs in there. I put some liver herbs in there. I put some immune boosting herbs in there. So it's really trying to make the formula more holistic. So, but I would not count even on my tea, which I think is an exceptional tea for boosting immunity, detoxing, cleansing the body, and fighting cancer cells and other pathogens. And many people have given the testimonial, even on my website, that it took care of their inflammation as well. And I'm sure, I'm looking at the herbs, a lot of anti-inflammatory herbs in there. And apparently that's why her husband took it, because somebody else had bought it, got rid of their inflammation. They didn't buy my anti-inflammatory tea. They didn't buy my arthritis tea. They ended up buying this Isaac tea because it got rid of they heard it got rid of somebody else's inflammation. But so, of course, it's going to be anti-inflammatory. Plus, it's going to be detoxing. Plus, it's going to clean you out and probably kill your worms, parasites. Your skin will improve. Your liver will contribute. So it's really a very holistic, complete approach. Not to say you shouldn't. I don't think you really should be taking that if you don't have cancer or you're not worried about it. A lot of times I just use it because people have had a tumor removed and they're worried about it coming back and spreading. And I think for that type of situation, that tea works. But in many cases I've never even given the tea out. But it does sell, and we do get good feedback on that formula. And but it's not a treatment all by itself. That is a very important thing. Your diet has to change, your lifestyle has to change, and all of your other health issues need to be resolved. And that particular cancer you have, whether it's a blood cancer or liver cancer, skin cancer, there are Ayurvedic formulas just for that particular type of cancer. And this tea is not for any particular type of cancer. It's kind of like supplemental. So you would have herbs to get with your health, your colon, your liver, your sleep. Plus, there would be a specific formula for your type of cancer. And then maybe on top of that, we throw in the tea to drink all day like water. It's a very holistic approach. And all of your bad habits, partying, drinking, smoking, staying up late, they all have to go. So I hope that gave you the big picture. I wish all of you the best of health and happiness. Don't hesitate to contact me. And God bless you all. Thank you very much.